So, do knee supports actually help with everyday knee pain? When I say everyday knee pain, I'm not talking about a big injury, no twist or pop, just something doesn't feel quite right, get that annoying pain. Some of the examples include walking, it might just feel discomfort, painful, out of nowhere. Standing gets tiring, the stairs feel harder and you get that annoying pain, go up and down. Or maybe not if you live in a bungalow, who knows? Anyway, these types of pain are actually really common, and it's more common than you realise. It usually doesn't mean damage, but if you're really unsure, please go and see a physio. They're great at what they do. I'm no physio myself. But yeah, go and see them if you have any concerns. Even when there isn't any damage, it quite often affects confidence and makes daily life harder because it leaves you wondering, doesn't it? So, do supports actually help, or do they hide the problem? We've heard that before, haven't we? We've had that debate or something similar along those lines. Let's talk about how knee pain builds up. So, most knee pain without an injury doesn't just come out of nowhere. I mean, it might, everyone's different, but usually there's some gradual reason for it. It can like build over days or weeks. You just notice it slowly getting worse. Some of the examples may include like long days on your feet, lots of walking, standing for hours, reduced strength, or just not enough recovery. You're just never resting or treating the issue like ice and stuff like that. Each one's small, but when they're combined together, they add lots of load through the knees. And the issue with that is over time that can lead to discomfort and irritation, and that leads obviously, all your pain and things like that. So let's talk about the roles of the muscles around the knee. So your knees rely on your quads, your hamstrings, glutes, and calves. They support your knees. They support your knees by controlling the movement and absorbing the force. When they're strong, they protect the knee, but when they're weak or tired, the knee ends up taking more of the load, and that's when issues can arise. So get that leg day in, that's my advice. 3 times a week? Nah, just once a week. So let's talk about what supports actually do. They don't fix the knee, they don't heal tissue, and they don't replace strength. That's really important. Let's not sell something which isn't true. However, they do provide compression, stability, and reassurance. And that's all people sometimes need. The movement can feel easier with knee supports. I've had it myself. So yes, they can help, but they are a tool. They're not a cure, and we must tackle the root cause itself. There's no point just relying on knee support and thinking everything will go away, because that's probably not going to happen. So examples of when knee supports may help: walking, gym workouts, standing for long periods, climbing stairs, or even like long days at work, and go on and on. Probably loads of different reasons. They especially help when the pain is linked to fatigue because they provide stability and compression. So the right type of support is important because you can just get some ones that just pull up and they fall down. So some of the supports, like the ones we sell, have adjustable straps as well, and they work by you pulling it on up through your leg, put it over your sock, pull it up and on. You wrap the straps around, you tighten it, and by doing that, it keeps it secure. It means less slipping and more stability, and it feels more supportive. You can sort of lock that position in place. So let's look at the bigger picture. Supports help, but not on their own. You still need strength, movement, and recovery. So important. That's what will improve the knee, not the knee support on its own. So using them at the right time, the knee supports, so they can help also with flare-ups and just general confidence in training and daily movements, but they don't replace strength and movement. The goal is not to rely on them, but use them whilst you work on the underlying issues. So the clue is in the name. They're a support, not a cure. Obviously, please get professional help if you have any swelling in the knee, lock-in, giving way, or have suffered a recent injury. If you suffered, for example, an ACL injury, don't just put a knee support on and think everything will be okay, because most likely it won't. I would not recommend that. So knee supports can help, especially if it's fatigue-related pain, but real improvement comes from strength, movement, and recovery. So use the knee support as a support. Again, the clue is in the name. It's not the solution in itself. They've got to work together.